Welcome back to Ozarks Tonight. I'm Heather Lewis. Greene County is teaming up with Burrell Behavioral Health to open a new behavioral crisis center. County Commissioner Harold Banks is with us tonight to talk more about the need in our community and also what we can expect from this new behavioral crisis center. So thank you so much for being here.
My pleasure.
First, let's go ahead and talk about the need. You know, often first responders are on the front lines of dealing with a behavioral crisis. What are the options for them to take people to right now?
Right now, the options are jail or to a hospital emergency room. And hospital emergency rooms are there to take care of people with physical ills, not so much with mental or addictive behaviors. Consequently, so many of these individuals who are identified as having these problems wind up being booked into our jail.
Okay, so this really dates back, the commission has been looking at this for several years.
Yes.
In 2017, voters approved a half-cent sales tax to help fund something to help with this crisis that's going on. Talk about how the collaboration with Burrell began, and did this kickstart that whole campaign to really help people in need in our community? We
have to step back to about 2016 when the health department initiated a multi-dimensional study on what are the community health issues that need to be addressed in this community. And that was done working with Burrell and working with both hospitals as other healthcare providers as well. What they identified was three primary areas: cardiovascular disease, respiratory illness, and mental health and addictive behaviors. Because mental health was such a large issue in that study, the Health Department went to the Missouri Foundation of Health and got a $250,000 grant to do an in-depth study of just what are those issues here and how serious are they. And we had the results of that study whenever we went to the people. And fortunately, the people voted to do something, and they set aside $2 million for the county to initiate something that would begin to develop here. We also took a look at our jail population, and when we did, we found that on any given day, 50 to 60% of the inmates in the jail awaiting trial were having behavioral health and or addictive behavior or mental health issues. That's a large segment of the population. That made us the largest community south of the Missouri River with inpatient mental health facilities being our jail. And that's not what a jail is constructed to do. Because of that finding, we have implemented several things in the county. One is specialty courts, courts for the mental health individual, courts for addictive behaviors, drug abuse, alcohol abuse. These individuals in those courts are assigned by the judge to go through a program that usually lasts about 2 years, or they will then possibly have to serve their incarceration, one of the two. And we found that most of the people that went into these courts really wanted to change that status that they were living in. And with help, they made changes. It's amazing to attend one of their graduations. We could see that these folks not only want help, but they can respond to that help without having to be hospitalized or adjudicated in jail.
So really it comes down to access.
That's right. What we found was two main roadblocks to mental health help in this community. Stigma, that is what is associated with mental illness, that people don't want to talk about it, or for some reason they're embarrassed to even acknowledge that they have this problem. And the lack of enough providers that could provide this. That is being worked on very, very diligently right now by all of our medical institutions, is getting more providers in this community. The thing that really tipped in favor of the crisis center was Burrell stepping forward and saying, you know, we have a building, and that building could be used as a center where instead of taking this person to jail, that person can be brought to that center where they can be put under observation, detoxed if necessary, and also determine just what is a type of service you as an individual would need, and then making those services assigned to them. Now, there is another element of the program that has to come into play here, and that is community health service workers. These will be individuals through the health department that work with those individuals who have been identified to help them access providers, medication, transportation, it may be housing. Also, our pretrial investigators at the jail can work with those mental health people from the county and help them access services. So it's a combination of services that come together, and the consolidation point is at the Borough Center for Behavioral Health.
So this is going to be open 24/7
Yes.
as well. And like you said, there's it's not just you come in, you talk to a counselor, you leave. You're
more than
really
that.
setting them up to be successful in life
That's
dealing
right.
with this mental health crisis.
That's right.
And when we say a crisis, how do you define that? What kind of state does a person need to be in to be able just to walk through those doors and say, I need help?
That would vary from the type of situation they're with, but let's just take a typical one that might be a depressive state, where they possibly are so depressed they either are considering taking their life, or maybe they've gone into a manic state and acting out. There are various actions that can participate being brought to that center.
When can we expect this to be built and up and running? Or I guess it's already a building in play with Borough, but renovations are underway.
We took the check to Borough last Friday.
Okay.
They have been given the check that the county was able to participate in this.
What kind of difference will this make for the Springfield community?
I think that what we're going to see in this community, number one, is a realization that the earlier we detect a behavioral or mental health or addictive behavior problem, whether that be drugs or alcohol, the faster that's detected, the quicker it can be prevented. And actually, that's what this program is. It's a program that's designed first to try to prevent these things from occurring, but when they do occur, to see that they get appropriate and timely attention. And that's very important for good outcomes.
Very good. This is Greene County Commissioner Harold Bench. Thank you so much for being here, and we'll, of course, continue to follow this as it unfolds and as it opens and the progress as well.
Thank you for this
appreciate it.
opportunity.
We'll be right back.